There are new developments to share this morning in a CBC News investigation into allegations that pharmacists at Shoppers Drug Mart face pressure to bill for medication reviews. The service is paid for by the government, and what happens is pharmacists consult with patients about their medication. And then in our previous story, the president of Shoppers denied there was pressure on employees, said there were no targets placed on staff to bill for that type of service. But Angelina King has an update to her initial report, and she tells us this morning that goes against what frustrated pharmacists are saying and what internal records are showing.
Late last month, the president of Shoppers Drug Mart, Jeff Legier, had this to say about targets or quotas for billing taxpayers for medication reviews.
We don't have targets or any other kind of element like that.
But it didn't take long for more than a dozen Shoppers pharmacists to reach out to us with a very different story.
It was really disturbing to us as associate owners to hear that.
I was very angry because this is not the truth.
He knows full well that they're in place.
CBC isn't identifying those pharmacists because they're current or former Shoppers pharmacy owners and fear reprisal for speaking out. We aren't using their real voices. But they all had the same thing to say, that Shoppers leadership does pressure them to meet targets, and not just for medication reviews, but for all professional services, including prescribing for minor ailments and handing out naloxone kits. Most of the services are billed to the government. The pharmacy owners get a cut, the rest goes to the corporation.
We have brought this up many times starting last year that there shouldn't be any targets or quotas when it comes to professional services.
Internal documents from across the country obtained by CBC News show weekly and yearly plans for how much money pharmacies are expected to bring in from professional services and pressure from higher-ups to hit those numbers. Like this January email from a district manager stating, "I am writing to express my deep disappointment in our team's performance during the first week of 2024. Despite clear plans and expectations, it is evident that we fell significantly short of our targets. I expect each team member to reflect on the reasons for this deviation from our plans and be prepared for immediate improvement." CBC requested an interview with the president of Shoppers about his claim the company doesn't have targets for medication reviews. We were told he was unavailable. A Shoppers spokesperson did tell us the company stands by the president's previous remarks and that their role is to help owners by working with them on a yearly plan to deliver professional services specific to their community. But current and former owners say they have zero say in the plan.
You have to figure out a way.
Shoppers also said, based on some recent feedback we've heard from a few pharmacists, we're reinforcing mandatory training for both our field and store support teams on the appropriate use of pharmacy metrics for patient outcomes, as well as our expectations for how to support and communicate with associates and their pharmacy teams. The pharmacists say the pressure to hit their targets intensified last year after they claim revenue from COVID testing and vaccines started to wane.
I don't think they wanted to see any of that money disappear.
Internal records show in a single week in Ontario last month, Shoppers billed $1.8 million in professional services. More than 3/4 of that was for medication reviews. And one pharmacy saw a more than 300% increase in the number of reviews it billed between 2022 and last year. The pharmacists we spoke with say they support providing these services, but
It is totally unethical to have targets.
This interferes with our professional judgment as a pharmacist.
And this issue has caught the attention of Ontario's regulatory body for pharmacists. It says it's working on solutions. Angelina King, CBC News, Toronto.